This will be the lecture portion real quick of for kinesiology tape. The main values are that it helps basically do manual lymph drain for you. And if I have the quickest reason for you to implement this, it would be that if you have areas with people, whether it be edema related or swelling related, you're not going to beat the tape in terms of the longevity of the duration of application and effect. So doing a little bit of massage in the area is always going to be helpful. So probably what I want to focus on mostly today is how we can integrate this into our practice so that we can just get the best results possible without relying exclusively on one or the other, and how can massage help facilitate the effects of the tape, and how can the tape actually help the effects of our massage continue beyond just that one session. Because a person can leave the tape on for days. Thus, if we work on the area and then we tape the area, now the tape is there helping sustain that adjustment that we created. If it's scar tissue and we did some work on getting that area more pliable, and then we tape it now for days, they have that little added effect helping keep that going. So it doesn't matter what it is. That's going to be one of the coolest things, is if we do massage and we do joint movement and we do some muscle end techniques, taping the area in a way that makes sense relative to what we did in the session, or what the client's goals are, we will get a longer sustained effect, because the tape will be there doing it for the days, and we just can give them a little bit of homework, which is pretty much going to be, let's say for edema, we put the tape related to lymphatic drain on, they just have to, that's lower legs. Now when they move their ankle around in a circle, just hanging out in the recliner, that tape is tugging and pulling and is doing manual lymph drain while they're just wiggling their toes around and rolling their ankle around. You're just never going to do better than that. And if you use it for nothing else, I strongly suggest using it for lymphatic drain and having it available to accomplish that. Because edema, lower leg edema, is going to be a really common thing. And if you have somebody come in that has maybe some bad bruising, you never want to tape over areas that are actively inflamed. But like a bad old bruise, you can tape over top of that.
What about torn muscle? What about torn muscle?
Yep, the torn, a lot of that stuff, as long as it's not too angry, is kind of the thing. The trick with an area that's really inflamed is you don't tape directly over it, but you can tape around it. You can tape adjacent to it. So let's say I have a very inflamed area right here from a mild or decent muscle strain. I should say strain. Sprain is a ligament or joint. All right. Strain, I could tape in such a way, like where it starts up here and splits, it is on either side of that. That's still going to help move that layer, right? If you think about even doing manual lymph drain, when I'm moving the skin, although my fingers are making contact with the skin in these isolated places, the skin between my fingers is also being moved, right? So you don't have to necessarily tape directly over top of a spot. You can tape near it, or at least above it. You want to be taping proximal to it so that the fluid is being pulled back towards the core of the body. But that's the cool thing. You have somebody that comes in with something acute, like in sports is real common, they got a big bang and bruise. This would be something that we could do, because you can't massage it, right? But you can do the tape over it. And when I show the quadrupus, where it's like 4 little tentacles, usually that's pretty safe to tape over some of these like bruisey areas. It's just like anything, I start off with telling you to be way over cautious until you get out there and get a bit more practice. And if you don't practice with this, then you're not going to be as confident and good at it, right? I went through, related to my history of this, I went through all 3 levels of the actual KT taping, like the conglomerate. Like the organization has 3 tiers of education. It costs a lot of money, and it's really good education. If you were going to use this a lot, That's kind of the gold standard in terms of some kind of legitimacy regarding this. That being said though, there is absolutely nothing, no required additional certificate or licensure to use this. Not a tiny bit. There's not even anything related to athletic tape. You should not do any of this without knowing a little bit what you're doing, but that's why athletes can tape themselves and all of that, right? And why any of these tapes come with little instructions of how to just tape yourself. So you don't need anything. I really say, unless you're like making this like a key aspect of your therapy, like your number one kind of thing, you don't necessarily need that.
Where did you take it at?
It was down in, it's been a minute. It was down in, was it Troyish? Something like that. But it was a while ago. Just one of those, because they would just rent the office space for the weekend.
Oh.
And then everybody would come in. I was the only massage therapist there. Everybody else there was PTs and chiropractors, because they can bill for this. So they were also talking about how to code it and everything like that. Really good information. I come at it, I mostly am trying to say, please everybody, you know, if you really want to deep dive in it, go for it. I do not think it's needs to be nearly as complicated as people make it out to be. So a big part of why I even have shown a lot of this is that many of the formulas I've shown here cover pretty much all your bases related to most areas and their issues. A good example will be like the first one and second one that I show, ankle and knee. If we follow this format, and basically it's covering everything from like your Achilles tendonitis to repeated ankle sprains to plantar fasciitis. You know, it's going to cover pretty much all of that, and then you can adapt it a little bit to a person's unique, like areas where the discomfort is in their anatomy. Same thing with the knee stuff. If it's an MCL, LCL, patellar tendonitis, you got both covered. At the elbow, if it's lateral epicondylitis or medial epicondylitis, golfer's elbow, tennis elbow, you might as well tape both, and you got them both covered. At the wrist, doesn't matter what the wrist thing is. Is it carpal tunnel or a strain, repetitive overuse, something like that? That formula will pretty much have you covered, because it's going to cover as much of the acting soft tissue anatomy that could be affected by all this stuff. So I'm trying to give you pretty much a baseline, and then what we're going to do is I'm going to ask anybody that has a thing, I'll just problem solve in real time how I would like do a little bit of massage, MET, the tape, and then also integrating this thing. This is the brand. It's Elite Hot Towel Caddy Plus. If you're ever going to make a long-term investment into a thing, in general for massage, this is the one. It really kicks butt. It's held strong for a really long time. You can't go wrong. And just in general for massage practice, being able to start the session by grabbing the hot towel to warm my hands up, work on the feet a little bit. It feels really good. It warms my hands up so that when I start working, everything's more pleasant. Just for that, being able to incorporate that hot towel as a hydrotherapy, thermal therapy thing anywhere in your practice is a great thing. Just incorporate, they got a wrist thing and they got it doesn't matter what it is. Use a little bit of that with the massage. And then comfort-wise, they're laying supine at the end, hot towel on the back of the neck, right? Just a really nice added nuance that can make the session much more pleasant, potentially more effective, and your hands are warm. But what we also have is the ability with the wet towels to be able to clean an area off. I have wet towels and dry towels. I can clean the area off with the massage oil or whatever the client might be wearing, because a lot of times the reactions that occur related to the tape is due to there being some other factor on the skin. So you want to make sure the skin is clean and dry before you apply. Right? So having that and then having, in order to get the adhesive to like fully liquefy and stick, what you'll usually see practitioners do is they'll apply it and then they'll rub, right? And that is just using friction to warm the adhesive up so that it liquefies and fully like adheres itself to the skin, right? But it's much more pleasant for everybody and way easier on you to just grab a hot, dry towel and rub that over the area. That will get it to adhere much better and it'll feel a lot nicer. So the incorporation of using hot, and you could microwave the towel too. And so you be careful how long you microwave it. But using something like that to make your life easier and to get these applications to be more effective, that's, I strongly suggest. Other things that people do, there are sprays for extra to make it the skin stickier so it lasts for longer. The only thing I really caution you with, and we'll talk about this as I go through some of the brands up there, is that the delicacy of somebody's skin. So the more frail and thin somebody's skin, the more careful you're gonna have to be, right? So a very young person or a very old person, you're limited because you wanna be cautious about putting the tape adhesive on that skin. They're more likely to have a reaction and the pulling off of it. So thus, what do you think would be the best place and way to take tape off? Any thoughts on what you might want to do? In the shower, hot running water, or soaking in warm water. Yeah, that's what you want to do. That's the only thing it can be an unfun time, especially if there's like hair, right? It can be an unfun time. If somebody is especially hairy, like I'm not too bad, like this wouldn't get in the way, right? But much more than that, it's gonna be you're not gonna get a good adhesive. And you don't wanna shave people. So don't just buy trimmers. You're gonna have to tell somebody, like an athlete or somebody, if they want their legs like taped, they're gonna have to come in with that down. It doesn't have to be shaved, just like trimmers or something like that. But if they got thick body hair, especially like the leg hair, you're just not gonna be able to tape on that. Going up onto the base of the neck, right? Like I kind of need a haircut, but
I got you.
Yeah, right? Yeah, I should just come. But yeah, the neck hair, it gets in the way. So taping for most people is like headaches and stuff. Like unless they're like cleanly shaved bald, like it's just not gonna. Now I had clients that had that, and it was cool because they were the only people where I could tape up like over the occipital like base. But they were the only ones that I was ever able to do that with. Most people, regardless of what my goals might be, I'm limited by some of those constraints. And hair is certainly gonna be one. And that's the biggest issue for doing kinesiology tape for the neck. Because you usually can't tape it in a way that's gonna really do something because you can't get high enough up on the neck without getting their hair. So, there you go. The brands, let's cover that real quick. KT tape, so I actually should have written kinesiology tape brands. Kinesiology tape. You can say you do kinesiology tape. You want to be careful with saying you do specifically like KT taping. I think most people don't care, but like technically KT tape is a brand. And if you were teaching KT tape, like I can't say that. I can say I teach kinesiology taping and therapeutic taping. But unless I went and got the added credential from the KT organization as one of their formal instructors, I can't say I do KT tape brand instruction. So it's mostly semantics. KT tape, as the OG, has, this is an example of the sports version. So you can pass this around a little bit. And we'll just be doing some comparisons as we go. And while I'm talking, anybody that has a box, go ahead and bust this out. This one, the Spartan tape, is a bit more similar to the traditional, just normal original KT tape. If you get just the normal original KT tape, it's a bit softer, it's a bit more, porous isn't quite the right word, but it's flexible, but it's more, it really is more porous, because it does breathe better. The adhesive though is not as strong. I tested a lot of these. The way I knew how to test this actually is by applying it myself and then going in the saunas. And if it immediately melted off, I knew the adhesive was bad. So the tape ideally should be able to hold up some. No, the original KT tape brand and Spartan brand and the TheraBand one, the one that has these cool geometric hexagons. Are they hexagons? Yes. They are the ones that kind of have a more gentle adhesive and are a bit more porous. So for slightly more sensitive skin that you're going to use this with, this is the one to, if you're going to choose on somebody where you're like, they're not so sensitive, I think they can't be taped, but they have, you know, you just think to yourself, maybe I should be a little bit more cautious, then you want some of a more generic, softer, or like just basic normal tape. The piece of the KT tape that was passed around is the sports tape. That's Spartan.
It's over there.
The little strip.
Oh, the little
Yeah, that little blue strip that has like the kind of, and if you look at even the sheen of it, like it's made of thicker stuff. Okay?
So that's the one that you said is good for like sensitive skin?
This is
Or
the
the other
sport version
That's the sport, okay.
of KT tape. Now I mostly used the sport version of KT tape. That's the one I use, and they even have like a sport plus, they have one like really meant for water-based athletes that's even more durable. Just always know, the more sporty it is, the more durable it is, the more aggressive the adhesive. So it's gonna be a worse time taking it off. If it can sustain like full underwater activity, which these are all can sustain some kind of like waterworks. Like even the basic tapes can usually survive like a couple showers maybe, but just always remember that. If it says sport on it, or it says like extra something, it's gonna be about the adhesive, and that's gonna be your biggest cautionary thing with your clients, is do you think, you know, how well is their skin gonna do? You don't want them pulling off a layer of skin, ideally.
I mean, I do have a question. When I was at the hospital, there was quite a few people, honestly, that have allergies to adhesives. So should you not tape up somebody if they're allergic to
If they're pretty consistently, then you should be pretty careful, yeah. And like anything, you could do like a little spot test or something. Naturally, these companies, and that's where I do kind of trust like the bigger brands a little bit more, like the KT tape and TheraBand. They don't want those adverse reactions, so they try to make it as hypoallergenic as possible. They really do. So there's no latex or anything like that in there. Regardless, people sometimes still have reactions, and it just is what it is. One factor being, make sure you clean the skin. That'll help usually a lot. But if somebody has an adverse reaction, the overarching statement to a client, and I say this even to you as you're all about to, you know, dabble in getting taped, if it starts to get red or itchy, you take it off. You don't leave it on. You take it off immediately. And ideally you take it off under running, warm water. And that'll be the easiest way that you can do it. But yeah, if there's any kind of redness, any kind of itchiness, and it doesn't tend to be too bad. Like if the athletes, for example, this is way less than any of the athletic taping they're putting on themselves. So, all right. Why? Let me come back around eventually to TheraBand. Dynamic tape is one that I have not brought in here, that I did when I worked with the PTs in the sports world. They actually, the athletic trainers and PTs, they like the dynamic tape. A bit hardier, and it can flex a little bit more in like the horizontal, like if I'm talking vertical versus horizontal, it can stretch some multi-directionally. So it's a bit more versatile, a bit more hardy. It held up really good. It looks cool. It's kind of got like a tribal tattoo design thing going for it. If you're gonna pick like a hardier tape, I would probably suggest the dynamic tape over rock tape. Rock tape is cool, but it is aggressive. It's like the Gorilla Tape to masking tape. Like it's really thick, and the adhesive is really strong, and it's a good product, and you can get it in all kinds of cool patterns. You can go from cow pattern to camo, all of it, right? But I probably would, if I was gonna pick a hardcore tape to buy, I would get the dynamic tape, just because of the added versatility. You want your best value, if you're gonna be using this a lot, then Spartan tape, there you go, regardless if you're a Michigan fan, but Spartans, you can remember that.
I think they rebranded to Sparthos.
Sparthos?
Yeah.
Ah, well, okay. Sparthos tape. You can get a big old roll of that for a little bit less, and if you're gonna use this a lot, like you'll go through if you're using it with like, you know, every other client, something like that, then that's the one you want. It holds up solid. It's in my opinion, it's just as good as the basic original version of KT tape or the TheraBand tape. So that's your best value. This one, and let me get one that has a pretty color one. I gave those out. Here, just so I can show it. I'm gonna steal your green tape. Switch out with basic beige. So exciting. Now, this one, now here's the thing. I actually don't want you to discount too much how people respond to it if they think it looks cool. All right? Because there is potentially a pretty, we gotta always be open to the magic of placebo. And I don't think placebo is bunk. I think placebo is magic, and you should lean into it. The more that people believe in it, and the more they can have kind of a positive reminder of something, then, you know, I look like a cool turtle. Right? and there's a cool turtle Band-Aid on my boo-boo, thus it's better, right? So it's there, there's something to that. And you can get kind of artsy with your application of this. You can make some pretty intricate designs and stuff. So there's something to the factor there. And I have thought a little bit in some of the sports stuff, like, is it just because it looks cool? Everybody wants it. And there is a sensation to it, but, you know, that's where a few of them with their designs and stuff, why not? Or the colors. Because we're having a few color options can be fun, because you could playfully with a person, like, which color do you want? Do you want the hot pink or the turtle shirt, or do you want to go, you know, or do you want to go like camouflage beige or something like that, right? But this one though, the cool thing about it from a teaching perspective is the hexagons are related to, if we make the small hexagon uniform, we take it from being like too squished and stretch it to the point that it's uniform, we're at 25% tension on the tape. If we stretch it to where the big hexagon is uniform, then we are at 50% tension on the tape. Thus, if we stretch to the point where that big hexagon, if I'm talking about it in this orientation, if it gets distorted the other way, where it's more horizontally distorted, has gotten really wide, then I know I'm beyond 50% tension. Now, usually it's gonna be just, you stretch it and approximate, that's 100%, there's 50, and whatever. I am not a person that in my practice, and after seeing it and doing it for a long time, I do not think it needs to be 38.72% to get optimal, you know, effects. You need kind of a general gradient of how you do it. And if you see me apply, when you do see me apply, it'll be, I kind of vary the tension based on where I'm at. And sometimes I'll even just be tugging on the tape and giving a whole variety of tension ratios as I work my way down. Where like some areas will be like 50, some will be 25, and some will be in between that. And I don't think that there's anything that shows that it has to be so ultra precise. And some of the manuals, they will show you that it had like, they're like, to get this effect on this particular tendon, it needs to be 40%. And it's like, you're just never gonna be able to realistically like measure that even with this stuff. But at least gives you some kind of metric to work off of as you're learning this. Where I try to stick with the idea of, is it 25%-ish or less? Is it 50%-ish? And then is it 75%-ish or more? And what are the effects of that? And then as you practice it more, you'll be able to dabble. And like anything, be open to the trial and error experience with people.
Oh, yeah.
And some people respond better to a lot more tension, especially when it's like going across like joint line spaces. This one right here, I've learned that most people respond best when I crank this to 100% tension. And the rest of it's like more in like the moderate 50 to 75%, but this one to help somebody with better posture and joint alignment here, the only way it worked good for me is didn't matter who it was. That one was at like 100%. Other areas, not as much. So be open to experimentation and in talking with the clients, see how they responded, and then you can always keep modifying it based on how they're doing. All right. Covered the brands. And pretty much if I were gonna say long term, I would say pick between these two, maybe go into dynamic tape, any of these three, sorry, and maybe be open to dabbling with dynamic tape, and have at least some of the sports stuff available. If you have somebody with like more durable skin and they really want it to last and stay on their body for like more than 2 or 3 days, then you need the sports stuff. The regular stuff won't hold up. So, and especially if they're gonna go and be active. Sorry, that's the more important part. If they're gonna go and have this tape on while they're doing an activity where they're gonna sweat and really, then you need the sports stuff, for sure.
How long does the sports stuff normally stay on the skin?
I mean, I've seen people go as long as keeping it on for a whole week.
Oh, wow.
But usually you should be suggesting around like 3 days.
Okay.
Yeah, 2 or 3. And if people get pretty conditioned to this, like anybody that's done like long-term athletics and has even learned how to tape themselves, like they can pull back like an edge that's coming up and trim that and get it stuck back down. You can teach them to do little things like that to keep it on there. Or teach them to apply it on themselves, or teach them with like a partner how to apply it on themselves. There's gonna be some body areas that are really difficult to tape and usually I feel like are not worth the trouble. The hip is the best example of that. Everywhere else, pretty much you can tape. Areas of the back, I have found very middling effects on that. I'll be showing, there's a version like in your paperwork here. Like you could do like this H shape down here too, but it just kind of can be a little awkward getting that tape down over on the cheek, you know? And the reality is the only way to make this tape truly be doing something is the stretched part of the tape needs to be over the area you're trying to affect. So the stretched part of the tape needs to be crossing the joint line you're trying to affect, or it needs to be going over the tendon you're trying to affect, or it needs to be over the section of muscle you're trying to affect, or it needs to be over the scar you're trying to affect. If the stretched part of the tape isn't on that, and it's an unstretched part of the tape, it's not going to be doing as much. So this can be a difficult area to do that H shape on because then you're near a crack, right? So doing kind of this X pattern works okay. The taping of the back is one of the more awkward ones. If it's related to like a spine related issue. If it's scar tissue, that's going to be an easy one. If it's fluid movement, that's an easy one. But if you're talking about crossing, like related to joint function and mobility, that's where some areas get more problematic. And then the hip. Draping to get there and taping around there is going to be quite the journey, right? So you're going to want to make sure you're really comfortable with the client, and then they have to be wearing appropriate underwear to even pull this off. It's not a hard area for a person to potentially tape themselves. So really, for a hip-related thing, I would teach them how to do it for themselves, because they can have both their hands available And that joint is so deep, you're not gonna do anything with this tape that's gonna help stabilize that hip more. There's too much tissue and that's too big of a structure. But let's say it's hip bursitis, then it could be pretty beneficial. For our bursitis thing, this can be really helpful because the bursa can be relatively superficial. Thus, if you can create and lift some space and help move that inflammation out of there, that can be a big win. But that's not too hard. The one here in the chart, not like I've usually ever taped, I've never taped somebody's solar plexus. I've never done that. I just didn't have anywhere else on this chart to put a version of what you would do for something, right? So the star pattern, or it could be just an X or a plus sign, whatever. But that pattern, you'd want the center of it to be over where the hot spot is. And it doesn't matter what it could be a weird nerve thing, because people do have that. They'll just have an odd hot spot related to something. If it's like a weird nerve thing, a bursitis, anything, then you can use that. Think like cupping. The center of the tape is where everything's going to be pulling and lifting up. So you do more of that, there's going to be more of a lift. So right at the center of the star should be where they're pointing at the bursa. And that would be perfect for a hip-related bursitis. Because usually going to be right there over the greater trochanter, show them that and be like, yeah, just create a little plus sign right over top of it, and then give them the tape as a gift. And then you've done your due diligence of showing them, the courtesy of how to do this. They could even go in the bathroom real quick, all of that, right? But that's an area that's just be tough. It'd be hard to tape and drape. All right. Any questions so far?
Can you do kids? I mean, I'm sure you can have the best skin.
With skin, you just gotta be careful.
Yeah, okay.
Yep. Nope, but
I mean, like the age would be like 9 for me.
yeah.
Okay.
Yeah, no, just like anything, I would suggest the basic, the simple,
Yeah.
the original,
Okay.
something, Spartan tape, Sparthos, the TheraBand stuff, or the just original KT, yeah. And then just watch. Usually if it's gonna get irritated, it'll occur within the hour,
Okay.
kind of a thing. All right. Now, the basics of application. You have it listed here, and this image is in the book as well. So let's read through it together. Stare at the upper right-hand corner with me. Yeah. A, tape tissue in length. We don't want to be taping skin wrinkles, right? And we don't want to be limiting a person's mobility. That's one of the added values of this, is the tape can be on without limiting any mobility. So if I'm going to tape, I would not tape some sensitive skin areas. Like I don't usually tape here or here. So like in the interior section of the elbow, that's gonna be sensitive. The posterior section just behind the knee, that's also sensitive skin. And there's gonna be so much there, like you would tape adjacent to it. And taping right over that sensitive skin area, sensitive skin area, use some common sense. All right, but if I was going to tape there, I wouldn't want to tape like this. I need to tape like this. On the reverse side of the elbow, which I might more often tape, would I tape it like this or like this? Waha. So you just have to position the body in such a way so the skin that you're going to tape is on tension. And you should know that because then the skin's not wrinkled. You want the skin taut so that when you tape it, you won't limit the range. But from a safety standpoint beyond that, it's so you don't tape the skin in a way where it could get irritated and rub, become abraded, right? That's one of the most common things that goes wrong with this, is it gets taped in some way where you don't realize there's a little wrinkle, and then that rub eventually irritates. So you want the most clumsy part of taping some of these areas, like this shoulder one, is the most common one I ever did for like joint stuff and posture. But it requires a lot of movement of the client to make sure this is long, and then this is long, and this is long. That's one of the greatest things, like when I'm sitting there at the seminars and they're teaching how to do all of this with clothing, like asking clients to come in with like straps or like, tank tops and stuff like that, and taping under that, and taping in a chair and all that, I went, I got side lying on the table. The person's already undressed, and I can position them, or I can wait until each position. We can be way more efficient with how we tape this because we can just utilize the fact that they're already undressed, and we can position them in multiple positions. All right, so tissue has to be on length. And then we're gonna walk our way through what this means, but pre-tearing the anchors are the ends. This isn't my best example. Let me try and grab this one. The anchors are the ends of the tape. And you want there to be like a good chunk. The goal of that is gonna be that this is where we want the tape to like stay anchored and not roll up. If I taped this also on tension, it will more easily roll up, and either the edge itself will just cause the whole thing to unravel, all that stuff. But we need this and this, the ends of the tape, to have zero tension so that they stay stuck, and then the working middle range of the tape will be able to last and continue to do its job. But the biggest reason is just so it doesn't roll up, and so the rest of the tape stays stuck down too. So the ends have to be zero tension, and they're called anchors. That seems to be the lingo everybody agreed on. So the anchors, they anchor the tape, should be zero tension. So it's rolling that, and then this is going to be the amazing, that'll be the biggest thing that we, that's pretty much all there is. Yeah, anchors, pre-tear anchors, anchor 0%. All right. We get to begin our things of application. I'll show you what I paid about $5,000 to learn. In about 5 seconds. Everybody get a piece of tape. Now these are all the pre-cut ones, okay? If I didn't have a pre-cut piece, who has that blue chunk that's square? Somebody has a blue chunk that's square, perfect. These scissors, scissors. You want some safety scissors. They have like these tactical scissors that you can buy. They're like, have everything from like a window shattering thing. Like paramedics use them. Paramedics will have them, nurses. But you want, see that little knobby? Yeah? Little safety thing so I don't stab someone. You want some kind of safety scissors. Now these are value brand safety scissors, and I do not suggest you get these for one reason is if you open these wide, right, that is not sharp. I go like that, and it's a pain. So I have to, when you're using these today, you got to keep them like this. They work, but they're value brand. Now if you got a big roll of tape, like this usually comes on just one long roll, all one continuous roll, and then you would pull about how much you'd want, you'd snip that off, and then I have to roll it over, and then round those edges. The reason to round them isn't for any kind of like added effect, it's that those corners have the greatest chance of getting caught and rolling up. So a rounded edge will stay better. And you know, depending on your OCD, like that's gonna bug me. I didn't get it perfect. But you can be more economical. You can get a nice long piece of tape rather than be using 2 pieces, or you can get a smaller piece of tape. So you can be a little bit more precise. However, it takes extra time. Like doing that every time, if you're gonna do like 3-4 pieces, that can get a little bit of a, and if you're doing it in the midst of a session, you know, every minute counts. So I waffle back and forth. This is your best value, and what we usually have told people to do, like over there, is we'll cut a bunch and we'll pre-cut them. But we'll cut a bunch off and round the edges and have like a supply of that ready to go, if you wanted to save some cents.
So on the one that are pre-cut, they have, you're talking about the anchor section.
Mm-hmm.
It's not the adhesive in that area is no different.
No different.
It's always the same. It's just by making sure that whatever we choose to be the anchor section, not to stretch it.
Yep, exactly. And it'll always be the ends, and don't make it too small. Like you need at least a half an inch. If I would suggest like an inch and a half, if not 2 inches. If you want that tape to stay, you have to make the anchors relatively substantial. So if I was applying this right where those lines are, that would be my anchors. It'd be, what is it, like 5 little cubes kind of a deal. Now those lines too, like that's a nice thing with some of the brands, lines for you like to be able to cut. When we get to creating the tentacles, like for the quadrupus, for lymph drain, that can help you be a little bit more precise, all of that. But, and like even here, you can just be like, all right, I know for this area I usually use 5 squares, right? And then that's what you cut, make your anchors, and then each anchor is a whole square, even though it's rounded off, and then it's 3 squares worth of working tape. Don't skimp on the anchors if you really want the stuff to stay on, all right? All right, so everybody have a piece of tape in their hands? Okay, here's the amazing thing. You have to pre-tear the anchor. The biggest thing about learning how to deal with this tape is how to apply it without making a mess of it. So I'm going to follow this line, and I'm going to tear that backing without pulling the tape off. So I can create a little pre-tear, 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 done. That's it. You're a master. Now we could go a step further. Like as I apply this, I could tear the middle of this so that I could tear the anchor, apply the anchor, and not have the tape roll over and stick to itself. And then I could pull off the middle section, stretch that, apply that, good. Then pull off the next part, stretch that, apply that, good. So you can tear this backing as much as you need to make it easier for you to apply the tape and not have it suddenly crimple over and stick to itself. That would allow, so here's an example of a little bit of, what I was talking about with in your pictures, it'll show like a specific order. And this is my suggested order for most of these, but it usually does not matter. The reason why I have some of these orders is going to be related to like, look how here at the front of the shoulder, how that green tape is sitting on top of the red. You don't want the anchors to be on the tape. You want the anchors to be on the skin. But the tape can go over another piece of tape. And if you're sneaky about it, you can have it go over the anchor of a piece of tape to be able to hold that down more effectively. So I have that red piece of tape going over the acromioclavicular joint of the shoulder. And it's a common area that causes issues for people. Doesn't matter why or how. It can be specific to that. You can get arthritis of the AC. Acromio, that's the acromion. Clavicle, clavicular. You can get arthritis there. That can get dislocated. It tends to get jammed. Pulsed or rotator cuff injury. It's a super common thing that has issues.
I have that.
You have an
Yeah, I had an
acromioclavicular?
MRI done.
You what?
I had an MRI done and I have arthritis.
Okay.
I'm not, yeah.
Maybe you'll be my shoulder person. All right. So piece of tape over top of that. Right? Now that's an easy one to stretch. Person's in sideline. Like that. Good. Now the anchors have to go here to the front of the chest and then there on the back. And if I had a longer piece of tape, I could be like sneaky with it and just follow the anatomy and cover whatever. Like right now, if I had a bigger piece of tape and I arc this over, I could be thinking pec minor, something.
And you're pulling backwards for that, right?
Hmm?
You're going backwards for that?
That one, when I show it actually, what I'll do is be a case where I actually rip off that entire middle section, hold onto the anchors, and then do this. And then apply anchor, apply anchor. There's only a few places where that makes sense. Here at the shoulder and at the foot. Where you actually, instead of taking an anchor off, applying that, and then stretching the tape, you take off the middle, hold onto the anchors, and cool, right? Mm-hmm. That's the biggest tactic here, is how do you pre-tear the backing and remove the backing to make the easiest time for you in actually getting it applied. All right, with this long piece though, so that one's not hard. Then the blue piece of tape is gonna go over like upper trapezius and down and come all the way down to help support deltoid. So 2 important muscles related to shoulder function. They commonly become problematic with any kind of shoulder dysfunction. The biggest issue being that the firing pattern issues get offset, and deltoid should be kind of the boss here. Deltoid is paired with your glutes. There's 3 sections of deltoid, there's 3 glutes. They each surround kinda the ball and socket joints of your body. The glutes are essentially what should be the most powerful and in charge of your low back and hip, and the deltoid should be the most powerful and in charge of your shoulder. The deeper muscles like your deep lateral hip rotators and your rotator cuff muscles are there for stability and to help things like stay on track, to keep the joint lines set correctly so that when the big movers move the joint, things aren't rubbing incorrectly. So if posture is bad, then things are gonna go off and all that. But my thought process here is stabilize the AC joint, cover upper trapezius and over that AC joint again. If I were to go more posterior, I could be going over top of supraspinatus, which is the most commonly torn rotator cuff muscle. So this is the scapula. The clavicle's all kinds of crazy on this. But if I can be using a piece of tape to support that, and then a piece of tape to go over top of that joint structure, I'm also gonna be basically tracing the tape right over top of supraspinatus, which is by far the most injured rotator cuff muscle. And if we go far enough, where people do this wrong, in my glorious opinion, is they don't go far enough down the arm to appropriately be supporting deltoid. See how far down this one is? Your deltoid attachment is all the way down here. It's low. So I want the anchor to be below that in order to actually be helping facilitate function here. This one, that anchor is not far enough down to be actually helping deltoid out. The anchor is on deltoid, but it's not going all the way over deltoid, right? So good job, bad job. All right, now the next one on this side is going all the way across and around. And this piece of tape gets, this whole pattern gets usually taught as like for glenohumeral glide. So the glenohumeral joint is the fancy word for the shoulder joint. The idea here is it's going across, has to be below the clavicle, go across that joint line where pec major attaches and goes over anterior deltoid. The issue here is watching out for the crease, right? You gotta make sure the chest is opened up enough to go right over top of that. And that's the annoying part here, is the armpit crease. Then you get around here, and imagine doing this all right now. I did this all as one piece of tape forever. And I'm just trying to save you the headaches that I had to go through to apply this well. Come all the way over, then stop, have the person roll their arm forward, then come back over, trying to figure out what to do about the posterior armpit crease, because that's also a bit complicated. Then, if I'm trying to be strategic about where to put the tape, I would like for it to go over teres minor, major, and infraspinatus. So that's the spine of the scapula, superior to it, supraspinatus, spine of the scapula, inferior, infraspinatus. So in this taping strategy, we will have covered at least 2, if not 3 of the rotator cuff muscles. We will have covered one of the major joints of the shoulder specifically that needs to move for shoulder abduction, which is the one that gets limited the most. And we'll wrap all the way around and support the shoulder from the front, which maybe could be helping this, but I doubt it. More likely what's happening here is it's helping with posture. But I digress. covering infraspinatus, and we could even, if we had a long enough piece of tape, but then you're using an awful lot, come all the way down and tape over middle and lower trapezius, which that's the muscles that need to help pull your scapulas back into retraction and depression. So the idea here is I tape in such a way to help open the chest wall, you know, help hug and help as many muscles and joint structures as possible, but also be thinking about what are some muscles I want to encourage to function better. For better shoulder function, yes, you need your rotator cuff muscles to be strong and stable. As far as the big movers are concerned, you usually need deltoid more strong, and you need middle and lower trapezius more strong. So if we could do all of that in one, that's something. And instead of doing one long arc like that, though, what we could do is, whether or not we did this one first or last would be whatever. But I could have done these first two, you know, the one here, one here. The order doesn't matter too much. I usually did the AC joint one first, so this is out of order. Then this one, and then instead of one long arc, why don't we go ahead and just roll this back. That would hurt. You want to do this under warm water. Okay. So here's the initial demonstration of anchors and everything, and then we'll start doing it actually on the body. All right, I'd have to have the person move in such a way, and sideline, this is the easiest because they can just be laying there, shoulder back, and they have to hold it there. And we're gonna pretend the biggest value of this one may not be that it's actually creating joint stability. It's that the sensory input of the tape on this area helps remind you to have better posture. Okay? To think about the fact that I'm taping a person in better posture and then reminding them that's how you should stand. You want your shoulder to feel better? It should feel like this. Now you have this as a sensory input that when you move out of that into bad posture, it'll remind you. You'll feel the tug of the tape and you'll remember and reset your own posture. So the biggest value of the tape might be that because of the extra sensory input, a person is then self-adjusting and then strengthening their own muscles to support either posture or joint alignment more effectively. In rehab, it could be a person has a knee injury and I'm trying to tell them how to set their knees so that when they do their squats, they're actively engaging a particular muscle, vastus medialis, more effectively. If I tape over top of that and I verbally say to a person, now when you do this, this is what I want you to fire. We have this additional sensory input helping remind a person to do that. They're getting more sensation from that region. Thus, they might be able to control and facilitate that action more effectively. So incorporating the tape for better posture and better overall mobility, it's not about stability as much. It's perception of stability and or it's just extra input so that they might engage things more effectively. All right. There's always a winner. Now, I would find the clavicle, and then the nuances of getting this tape applied, it's a messy thing. Like, do you just take it all off at once and then try to deal with it? Like, if I go like that and rip it all off, it might roll over on itself. So what I tend to do is set it on the skin where I want it, find the backing of the tape, and just use the backing of the tape. Pull that off, and then at least the initial line that makes contact will stick, and then I can get that set. Now, I want to make my life easier. I could even in real time just leave it like that. See, nothing's gonna not gonna stick where it's not supposed to or roll over itself. I could tear right then, that middle part, remove that so that I have a nice handle. I hold the anchor down and I take that a little bit wonky, that's okay. And now I have the person open, put the tissue on length, and then I go across that line. Then I remove the other piece of backing, put on tension, steer it. I do a lot of this. I'm holding onto the anchor and then I'm steering the application with my other hand, trying to make sure it doesn't get wrinkled. So I'm kind of pressing it like an iron to keep it nice and flat. Now I'm gonna use this one. Let's say I have this short piece of tape and I'm like, dang, I didn't support deltoid very good. So I'm gonna go down. This is why I like teaching how to do it this way more now, is we have one piece of tape covering just the anterior to the lateral side of the shoulder. And see how that would still be crossing deltoid? Deltoid's the most important thing, and it has 3 sections of it. We learn it as one muscle, but it has anterior fibers that do shoulder flexion, has lateral fibers that do shoulder abduction, and has posterior fibers that do shoulder extension. So the posterior and anterior fibers are antagonists to each other. We want to support all of deltoid ideally. So I've done that one. Now I can, this will do. Round this edge out real quick. That's why the pre-tears usually will be good, but I'm trying to use up some of these scraps. Now I can just do the rest of it, because now also I could just have a person lay, open the chest wall up, apply that, take a breath because I'm overwhelmed. Then have them roll forward to open this space up and then apply the next piece. And I think that's just a more simple way to do it, and I think it's going to be more effective because these long swooping arcs love to roll up. This arc here, that's real common, you can see it. Wherever the main part of the swoop is, the lowest part of the U, always wants to roll up. The knees, those will not stay. I mean, if you put all the spray tape, like stick spray and stuff on, you might get that to stay. But almost always, this posterior section of the tape on either side, when they get moving, that starts to come off and roll up. So even here, instead of doing a big U, do a V. And it will stay so much better. And then the areas where it's intersecting, you can have it have an additional effect. So LCL and MCL. Why not give that a little extra by just crossing over it and creating these V shapes instead of U shapes? All right. Useful client. So I haven't torn it, I only tore the anchor. I'm going to show it in a different version. I find where I want to be, set that. I don't want the anchor to be on top of the tape, I want it to be on this side of the tape. Got that. Now I could tear the other anchor. Remove all of the backing, which I don't usually suggest then until you're pretty practiced with this, because you want to be, the thing that'll get you is this rolls over, gets stuck to itself, and then you have a mess and you have to start over again. You usually can get it to unstick, but a lot of times it does just make a mess. Now, here's where with the tape that doesn't have hexagons on, right, you can kind of make an approximation. If anybody can see, if you shine it up at the light, you can kind of see these wave patterns. Those are meant to be measurement kind of tools, but in our dark clinical spaces, it's not usually going to be a thing for you. But 100%, 50%, somewhere in that range. 100, 0. So, that's where those hexagons could be really nice. All right, person's laying. I could have them laying like this. I apply that anchor, have them roll forward, and then here we go. Come right here, make sure I avoid that armpit seam, and then steer around. And I at least covered in for spinatus. If I needed to do more, then there's another piece of tape. But here's the reality, like applying more than 4 pieces of tape in a session where a person's paying you for massage, that's about as much time as makes sense. It works really good. Like I use this as a thing to help encourage the 90-minute sessions, as I would incorporate add-ons like this with this. Like you're a complex client that needs therapeutic change as your outcome. I suggest you upgrade to a 90-minute session, and I will include KT taping with that. Thus we get a little bit more time, like a full solid hour to work on the area, and then we have some extra time to do some interventions and the taping, and there we go. The thing about this too is like it's there. This is a nicety for people, like giving a person something to take home, like this little essential oil thing to take home for some self-care, a tape, whatever it is. Like I don't want you to undervalue the customer service kind of piece to this, right? So, and if it doesn't work, oh well. There are some people where this just doesn't feel like it does a lot. And that's just how it is, and don't judge that or think that it means the tape doesn't work in general. I had with like the shoulder stuff, if I'm being honest in the metrics, it was over 50%. So call it 60 to 70% of people with shoulder issues, I would tape like this, and it would be a miracle. It'd be wonderful, and I had a few people where every session was doing that tape, and it really helped, and they would try to leave that on for as long as possible. And helps with posture, but especially with just old injury, arthritis. This covers all your bases right here. Just remember not to do the big U, do a V. Other areas outside of lymphatic drain were real marginal for me. Knee stuff has always been kind of a 50-50 shot as to whether or not it felt like it did something good. Elbow stuff works really great because the tendons are so superficial. So your common tendonitis is here, boy can it be beneficial. It's worked really good for me. So they're superficial, can lift the space, elbow stuff great, wrist stuff pretty good, but anything on the hand, that tape, you wash your hands, it wants to roll up real quick. So it's a tough element of taping on the palmar side of the hand or the dorsal side of the foot. No, sorry, dorsal is the front, but the plantar side of the foot, there we go. Is that the kind of the additional oiliness here and socks and everything is problematic. The first demo I will do will be the foot, and a big part of that being showing how to tape the bottom of the foot so that the anchors that are actually on the bottom of the foot are reinforced with another piece of tape on top of them to help keep them from rolling up. Because there's just, unless a person's going to be in sandals, even that, there's a lot of vibration, you have some extra oils on the bottoms of your feet. So foot and ankle stuff is hard to tape just because getting the tape to stay is hard. But yeah, that's the anchors. Now for everybody here with your partner, everybody grab your piece of tape and we're going to apply it on each other. So this first one, what we're going to do is going to be the gold standard for wrist carpal tunnel. All right? Now, whoever's applying first, we're going to set our anchor and get it applied onto the palm. We want it pretty centralized so the tape is lined up with the wrist. Now, if we do this, we can just get the anchor on the palm. Make sure it's really on the palm, not over the wrist. Yep.
I'm excited.
You should be able to move the wrist and not have anything wrong. All right? Now what do we have to do to the skin?
Stretch it.
So where do I position? Like
Flex
that?
out.
Like that?
Yeah.
Yep, an extension. So we want the wrist in extension. And then the person just holds. The client has to be a participant in this. I'll show you how messy this is to do on yourself. You can, but now wrist in extension. And then let's just put, let's look at about, I can see those hexagons.
Mm-hmm.
We want the big one to be symmetrical. So try to get that big hexagon semi-symmetrical. And then bring that down. Smooth. Just get it applied a bit. Make sure the skin doesn't look wrinkled, the tape doesn't look wrinkled. And then take the backing off for the anchor. and that down at 0. Wow.
It is, yeah. That's what it felt like.
You're a master. That's what, yeah, I know. These are that's the problem with the pre-cut strips. Is this is a little bit long. But hey, those muscles go all the way here.
I love it. Okay.
The big muscles of the wrists and fingers, they start here. The bellies are here, and then their tendons all the way to your digits. For example, I taped my sister when she was pregnant. And there's a way to like, so you got a pregnant belly, and the idea is to like support the belly, right? So I harnessed it with the tape and pulled it up so that the belly was getting a little lift, right?
Where were you when I was pregnant?
Well, so most people. However, it helped. It helped.
Helps.
But what's the skin of that belly? It's really distended and taut already, right? So when she took that off, it took some skin with it.
Oh, son of a.
So although it worked really good, it felt really good for her, you have skin that's already tugged really bad, right? It was a cautionary thing. It was like a realization of, I don't know, that'd be a tough thing to say to a person. Like, this could help. But boy, is there a potential issue with the skin being more fragile because it's pulled so tight.
Is there a particular method to the removal?
Under warm water.
Okay.
Warm, immersed in warm water, under actively, yeah.
So like take a bath or something
Yeah.
and get it off
Yeah,
that way.
yeah. But I tell you what, it's still a journey. It's physics, all right? The tape is going to want to retract to its original shape, thus it's gonna gather to the center point of wherever it's on tension, regardless of how you apply it. It's gonna gather back to the center. So the idea of it facilitating or not facilitating a particular muscle based on the fiber direction, you are not taping on the muscle fibers. You are taping on skin and you're tugging on superficial fascia. And maybe that has an effect on those deeper muscles, for sure, because of the superficial fascia being tugged on them. But really, if we're talking about muscle function, it's because we're crossing joint lines. And then the tension here is either reminding a person due to sensory input how to better use their muscles, or maybe we're affecting the tendons that actually create the movement and pass that joint line. We put enough tape over a joint line like this, then that certainly is going to help make this feel easier, right? It should feel a little bit easier, maybe a little bit,
Like a little bounce.
but it's not to the point of, now, we're not going to spend too much time with wrist stuff, like when we have practice time in the afternoon, go for the rest of it if you want. The wrist one's not very hard, because all you got to do is the other side. I strongly suggest doing the other side.
Yeah.
Anchor, strip, anchor. Now both sides of the wrist are supported, and I really suggest that for a carpal tunnel, don't just tape this side. The thing that we missed a bit is I would have started the first one doing a piece of tape right here. Now that gets problematic though, because you gotta orient the wrist this way. You have to have a smaller anchor. The anchors can come all the way around even. But then you gotta make sure that's zero tension, then tension. You have to like orient the hand like this, tape an anchor, have them orient their wrist like this, put the stretch part of tape across the carpal tunnel proper, orient their wrist like this, set the other anchor. And then if you're going around, then you'd have to have them do this in here.
You do the hokey pokey and you try.
So, and since it's right over top that line, and with people washing their hands, which I really hope people are consistently doing, this is problematic. That one across that immediate line tends to be problematic. So at least doing this one, but if they have specific carpal tunnel, doing that bracket across and creating a plus sign shape here would be the suggested thing to do, and then balance it out on the other side. It's the exact same argument I will make with elbow stuff, is that there's always going to be an agonist-antagonist relationship here. So you might as well do your due diligence and get both sides affected. So if it's medial epicondylitis, which is golfer's elbow, or lateral epicondylitis, which is tennis elbow, take both, and you're good. And with elbow, it's not a big deal. Just leave it on extension. You're gonna go right over top both of those. Don't tape it like this. That's a nightmare. Just have the elbow straight on either side. We want to practice that one. That one's just not hard, right? The other ones are harder.